On the Medical Watch, we take a closer look at prostate cancer after two troubling stories about the disease today. The death of Dexter Scott King, the son of Dr. Martin Luther King Jr., and an announcement by Cubs legend Ryne Sandberg his prostate cancer has spread to other parts of the body. Joining us now is Dr. Srinivas Virganti, Rush University Medical Center urologist. Doctor, thank you for being here. It's such an important topic to talk about. I think for the most part, the perception is that men get their prostate levels checked, they find their cancer at an early treatable stage. But when we hear about two cases like this, it seems that that is not happening.
Yeah, there's a troubling statistic in how prostate cancer has been diagnosed. And that is specifically that the amount of metastatic prostate cancer or cancer that's spread at diagnosis went up. And we believe that's coincident with when prostate cancer screening rates went down.
I'm sorry to interrupt you. I just was going to say, at what age should men begin screening and how often?
So this should be a tailored decision. If you haven't talked to your doctor about it and you've reached age 50, you should probably go do that. You should even broach the subject earlier if it runs in your family, and certainly if you have one of the known genetic conditions running in your family, because screening should start sooner, even possibly as early as age 40.
So what's going on? Why fewer screenings? Is it not covered by insurance? Why are men not going in?
In general, this is one of those things where the pendulum swung. And about a decade ago, there was a lot of question about the relative value of prostate cancer screening, and there's a large abandonment of it. It really decreased over time because public health authorities and really the field in general started to question whether prostate cancer overtreatment was making the disease, it was highlighting the problem of overtreatment. So there was an abandonment of screening. The problem with that is there is a lot of people with severe prostate cancer that were missed. And so what we're trying to do now is smarter screening and better ways of treating. We're leaving people with low risk prostate cancers alone. But what we don't want to do is just not screen, because there are real losers in that process. If you don't, meaning your prostate cancer can be found at a much later stage, potentially spread. And at that point, it becomes uncurable. And if we catch it early, the survival rate is excellent, but it's when we find it late like this, it makes it more difficult for us.
So where does it typically spread, and then what's the prognosis?
Yeah, so prostate cancer does have a reliable method of spread. It spreads to lymph nodes in the pelvis and in the body, and it also spreads to bones. Beyond that, it can spread really anywhere, but it takes a long time, but it goes to those places first. The prognosis, if it's spread, it really is individual, but it does. Many men die within 5 years if it has spread. So the secret is checking it early. Now, having said that, new treatments have been discovered even in the past decade that have been almost doubling this, right? So we've been having the best way of doing this is having your doctor team up in a multidisciplinary fashion, so that it's not just a urologist like myself, but also working with radiation oncologists and medical oncologists.
Very quickly, doctor, before I let you leave, are there any symptoms aside from the screening that men should be looking out for that are a real red flag?
Yeah, so really red flag is if you haven't been screened, but of course urinary symptoms, bone pain, these sorts of things. But sadly, many of these cancers can happen even without symptoms. So you don't want to be lulled into a false sense of security. And so if you haven't been screened, it's a simple blood test. And particularly if it runs in your families and in our community amongst African Americans and whatnot, it's much higher. So we don't want to miss the boat on anyone that when it's such a simple fix.
It's an important message and an important screening. Dr. Srinivas Virganti, thank you very much for that message.
Thank you.